Hello, I am Dr. Obidino Elizabeth Nonobari, and in this video we shall be looking at what antenatal care is not. In our previous videos we had talked about what antenatal care is. We took some thoughts, opinions, perceptions from people on our streets. We also looked at the obstetrician's view to antenatal care. You could revert back to those videos to do some catch-up. We established that antenatal care is the care of a pregnant woman from the time she conceives to the time she gives birth to her baby. Antenatal simply puts the period of pregnancy. Care is paying attention to something to protect it and avoid hurt or damage to it. So basically in antenatal care, we're trying to pay close attention to the pregnant woman and the pregnancy to guard it and avoid hurt, injury, damage to it. So antenatal care involves who, where, and how. Who is involved in the antenatal care? Where is the antenatal care taking place? And how? What are the components of the antenatal care? So for us to give your antenatal care or that antenatal care a pass mark, all these must be taken into consideration. Okay? So that you are buying some drugs or you buy drugs from a shop, a pharmacy, or a chemist, wherever, and you take it, does not mean you have registered for antenatal care. Because, what are those drugs? What are they working? What are they for? Do you know? You say, it's routine drugs. So what is routine drugs? What are the routine drugs? Okay, what and what makes up routine drugs? So it's important that every drug that a pregnant woman takes is prescribed, because every drug a pregnant woman takes also affects her baby. Also, that you measure your blood pressure every 2 weeks, every 1 week, or whatever interval does not mean that you have registered for antenatal care. Because what is the interpretation of the blood pressure you have just checked? Is it high? Is it low? Is it normal? So you see, because the interpretation of the blood pressure is as important as carrying out the blood pressure, if not much more important. Okay, not just checking the blood pressure, but being able to interpret the blood pressure. Okay, so the one that even scares me more is massage. I can't wrap my head around it. Even for someone who is not pregnant, a man, a woman, massage is very stressful. So why will you even go for massage? What do you aim to achieve? So massage is not a part of antenatal care. As a matter of fact, it's injurious to the pregnancy. Going to set the womb, if the womb is not set, will it carry pregnancy? Will it even carry the baby? Will it even, allow the baby come in the first place? If the womb no set, pikin no go enter inside. So why are you going to set your womb? We lost a woman a few days ago, about a week thereabouts. It was her first pregnancy. She did not register for antenatal care, but the pregnancy was due. And then I think she did a scan that said the baby was not lying well. So they decided to go turn the baby to lie well. Well, they achieved their purpose, but because other things were not taken into the consideration out of ignorance, of course, the person who did it for her did not know the other things to check before doing that. So they ended up turning the baby, but she started bleeding profusely. And she bled. She was brought to our facility, but she did not not make it. This is one of the kind of things we see over and again. So telling of baby, yes, can be done, but has to be done by a skilled personnel. That you have a medical personnel around you who you go to ask, hey, this one, hey, that one, hey, one thing, does not mean you have registered for antenatal care. I will leave that as that, okay? Also, you have a woman who has had 5 pregnancies, 10 pregnancies, and you take counsel from her, you take advice from her. She tells you, oh, don't eat this, don't do this, don't do that. And you think that is all that antenatal care is. No. That is not antenatal care. You see, yeah, she don't sabi everything. Na lie you. Every pregnancy is different. And as a matter of fact, that woman, if she gets pregnant again, should register for antenatal care. Because yes, the risks of injury in a pregnancy increases with the number of pregnancies that a woman has carried. So careful attention needs to be paid to a woman. My dear, if you are in any of these categories we have talked about, just know that you have not registered for antenatal care. Go and register for antenatal care. If you know anybody, any pregnant woman around you, sister, friend, relative, neighbor, please help me ask them, have you registered for antenatal care? It's a very important question that may just be saving the life of that woman. So please help us share this video, comment, like, and more importantly, subscribe. I'll see you again in our next video when we shall be discussing harmful practices in pregnancy. See you then.